Welcome to the Maria Holder Diabetes Center, home of the Barbados Diabetes Foundation. The Barbados Diabetes Foundation was formed in 2001 as a mechanism for providing a holistic approach to the management of diabetes in Barbados. It benefited from a grant from the Maria Holder Memorial Trust to construct a specialist diabetes center. The development of this center was the brainchild of the late co-founders, Dr. Oscar Jordan and philanthropist, Mrs. Maria Holder. We are proud of our achievement of the establishment of the Maria Holder Diabetes Center for the Caribbean, opened in 2014 in Barbados. The Diabetes Center is an institution dedicated exclusively to the management of diabetes in Barbados. It offers a multidisciplinary approach to diabetes care, which focuses on making the patient the center of care and the decision maker in their care as much as possible. Now that you know a little bit about us, let's talk about our services. Patients can be seen by a variety of healthcare professionals that specialize in diabetes management and other areas relevant to diabetes care. They may be seen by any combination of providers to meet their specific needs relevant to the issue at hand. For example, maybe a diabetologist, diabetes specialist nurses, and registered dietitian at the same visit in a holistic exercise. We offer a very wide range of services, which may include personalized diabetes and hypertension management, diabetes self-management, education and support, insulin startup and adjustment, and other specific advice for control. We also provide nutrition and weight management for individuals with and at risk of diabetes, as well as group nutrition education. As part of this holistic care, foot risk assessment and advice is offered for all patients, as well as wound care and podiatry specialist opinions. Other services available include cardiology consultations, diabetic eye screenings, which are supported by a consultant ophthalmologist, initial vascular screening to screen for reduced blood flow in the lower limbs, physiotherapy through a partnership, and remedial bodywork therapy. It does not stop there. We would not want to leave out diabetes and pre-diabetes screening and on-site testing of blood glucose control with HbA1c, kidney testing, cholesterol checks, and ECG, also known by patients as a basic screening heart test. The podiatry team is comprised of a podiatrist and 2 nurses trained specifically in wound care. Services range from nail and callus management to wound care inclusive of debridement and dressings. The team is supported by 2 diabetes-trained physicians who also have significant foot care experience and a specialist nurse and dietitian. The key to preventing amputation is early recognition and regular screenings. According to the American Podiatric Medical Association, including a podiatry team in your diabetes care can reduce the risk of lower limb amputation up to 85% and lowers the risk of hospitalization by 24%. The Ministry of Health Referral Program is an arrangement between the Ministry of Health and Wellness and the Barbados Diabetes Foundation to aid persons newly diagnosed with diabetes, persons with poorly controlled diabetes, or those with non-healing diabetic foot ulcers. It consists of 6 months of specialized care covered by the Government of Barbados. Patients are referred from the polyclinics to the Maria Holder Diabetes Center via the completion and submission of the referral form. Once we receive a completed form approved by the senior medical officer in the polyclinic, the patient is contacted and their first appointment at the center is booked. More urgent referrals, for example, some cases of wound care, will be seen within 24 hours by the request of your doctor. When a patient first visits us, they fill out an information form with all personal information and emergency contacts. They are then seen by the assessment nurse to have their blood pressure, weight pre-assessment, and a variety of blood tests done. This is followed by a consultation and dietary evaluation with a dietitian, and finally, the patient meets with one of our physicians. Our findings have shown that on average, 70% of persons exit the program at the end of the referral cycle with an HbA1c of 8% or less. Now, let's hear a few words from some of our patients.
Well, I found the service is very good, and I would advise anyone who is a diabetic, give it a try because it definitely do work. Once you follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. It can work for you. It was very extremely helpful. But they didn't only just stop there on concentrating on the eyes. I had a nutritionist that taught me the right way to eat, a physical therapist. I also was taught, as I said, the right way to eat, the portions that you do put on your plate is very important, and there was a chart that was given for me to follow. They didn't tell me. They also give me documentation, proven documentation. I had pamphlet, everything that I cannot follow, so I wouldn't get off track or go astray and do my own thing. So yes.
My interaction with the Maria Holder Diabetes Center has actually been through Dr. Diane Braffett. She has such a heart for pure persons, and then the heart to see change as relates to diabetes, hypertension, etc. Dr. Braffett is receptive and beyond. Not only does she answer the questions, but she's always willing to give advice and make suggestions. So the center, including the nurse, in addition to Dr. Diane, has asked me to, if I'm going to go the route that I am seeking, to really and truly be very disciplined in my diet and my exercise. For a long time I was prolonging not to have my eyes, I went to get an eye screening. I checked for a long time, and just about a couple months ago, Diabetes Foundation, they had called me, Dr. Braffett, sent the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with the result. So I would say yes, that is very good. It's very good for diabetics. I would give it a 5-star.
We hope you found this video informative and it has cleared up any uncertainties you may have had. Remember, for further information, you can always refer to our website, the BarbadosDiabetesFoundation.org, call us directly at 417-0305, or send us an email to clinic@BarbadosDiabetesFoundation.org. There will always be someone on hand to answer your queries.